Okay. So I'm going to check the order for my patient and check and see if she has any allergies. I'm going to assess my patient. I'm going to wash my hands. I'm going to introduce myself to the patient and identify the patient using two identifiers. Um, I'm going to provide for privacy, and I'm going to explain what I'm doing to the patient. I'm going to educate my patient, and then I'm going to evaluate after. Um, so my patient is 2 days postpartum. Um, I'm going to assess her vital signs, her lung sounds, her heart sounds, and her bowel sounds. I'm going to ask her to use the bathroom and empty her bladder before the assessment, and then I'll assess the color, odor, and amount of urine. I'm going to assess her breast for tenderness. I'm going to assess her nipples for any crust, bleeding, or redness. I'm going to make sure her breasts are symmetrical, and I'm going to educate her to wear a good supportive bra. Um, her uterus, it should descend 1 centimeter per day after being postpartum. So since she is 2 days postpartum, her uterus should be 2 centimeters below her belly button, and hers is. Um, I would assess whether it was firm or boggy, and hers is firm. In the immediate postpartum period, the uterus should be assessed every 15 to 30 minutes or so. So if she hadn't voided before the assessment, I would go ahead and have her use the bathroom and check for any bladder distension. I would ask her when was the last time she voided, and I would check and make sure see if she had a Foley catheter or anything like that. I would ask her when her last bowel movement was. Since she's postpartum, she's at high risk for constipation, so I would educate her on the prevention of constipation. I would tell her to make sure that she takes her stool softeners, and I would ask her, I would assess her comfort level with using the bathroom. The lochia, I would assess her perineal area. I would assess the amount, the color of the blood, and I would check for any blood clots. Since she's day 2, she should have the lochia rubra. And to assess the amount of blood, I would ask her how many pads a day she was using, or weigh the pads, either way. So if she had an episiotomy, which is an incision to enlarge the vaginal canal, I would assess for redness, edema, bruising, drainage, the approximation of the sutures, the any presence of hematomas on the perineum. I would check and see if she had any hemorrhoids, and then I would educate her about comfort measures. And she can do a sitz bath, use peri bottles, Epifoam, or she can use the benzocaine. So then I would do the Holman sign, and to do that I would extend each leg and then dorsiflex, have her extend each leg and dorsiflex each foot. So Carly, if you can you do that for me? I need you to flex your legs out and then flex your foot up. And did you have any pain?
No.
Okay. So I would make sure she didn't have any pain while doing that, and I would assess her calves for any redness, edema, and I would check the circumference of each to make sure that they're not different sizes. So then I would assess her mood, her interaction with the baby. Is she holding the baby, making eye contact? Is she responding to the baby when she cries? And then the woman will go through 3 phases: the take in, the take hold, and the letting go phase. Then I would assess her energy level and see how she's eating, how she's sleeping, is she resting well. I would assess her pain using the What's Up acronym. I would teach her to drink 2 to 3 liters of fluid a day, or teach her about early ambulation, and tell her not to do any vigorous exercise for about 6 weeks. After my assessment, I'm going to make sure my patient is comfortable and she doesn't have any needs or concerns, and then I will document my findings.